how many of your clients have had a background of trauma or unmanaged stress?
A lot, a very high percentage experience stress and trauma. If I had to put a number on it, I would say probably at least 70, 80% mention stress and trauma as being a factor around the time of the development or a few years prior to development, because as we know too, usually it takes time for autoimmunity to develop. So there's like a timeline. And so someone, maybe the year they develop Graves, felt like it wasn't too stressful, but maybe a few years before, although again, certainly in many cases, they experience the stress also the same around the same time. But yeah, it's very, very common. I know it was a factor with me, the stress, which we could definitely chat about. But when it comes to patients, that's something that I do have them fill out their perceived stress levels and stress handling. And not all the times, but many times it's high. And honestly, most of the time when they put that it's low, I need to clarify. I'm like, okay, maybe it's low now, but how was it when you were diagnosed? And many times I'll say, well, yeah, now it's not too bad, but around the time of being diagnosed, or again, a few years prior to being diagnosed, there was a lot of extreme stress or, some type of trauma that was a factor. So yeah, very, very common.